Good morning, sir. My name is Cuarteros, BSN-2C Group 4. Today, I will demonstrate home visit with bag technique. So for the definition po, a home visit is a professional face-to-face contact made by a nurse or midwife to a patient or family to provide necessary healthcare activities and to further attain an objective of agency. So for the purposes po, first is the accurate assessment of the family's living condition. Then second, educate the family. Then prevent the spread of infection. And then provide supplemental interventions. And for the last is provide the family with greater access to health resources in the community. So for the procedure po, for the pre-visit phase, first is during the pre-visit phase, if possible, contact the family and determine their willingness for a home visit. Then, assess the willingness of the family for a home visit. Then, if family is willing, appoint them for a home visit schedule. And after that, formulate a plan for a home visit. Then before leaving the health facility, check the contents of the nursing bag and the other articles. And then inform other members of the health team such as the barangay captain or barangay kagawad on health. And then the barangay health workers, your itinerary, and as much as possible, apply the body system when conducting home visits. So for the in-home phase, the initiation, knock or ring the doorbell. So I will going to knock or ring the doorbell, and at the same time, in a reasonable, loud but non-threatening voice, then introduce and identify yourself as the nurse in the community. Then good morning po, my name is Cuarteros, a student nurse from CSPC. So on entering the home, acknowledge the family members with a greeting and introduce yourself as the agency you represent. So again, good morning po, my name is Cuarteros, a student nurse from CSPC, and today I will be going to conduct a home visit. And then at this point, observe the environment for my safety. And then sit as the family directs you to sit, or ask permission if you could sit. And then establish rapport by simple having a communication to a respective client to at least gain their trust. And then state the purpose of the visit and source of information. So the purpose of this is to know the current situation of the family and their house. And then for the implementation, conduct interview and health history taking. And then perform the bag technique. So for the definition po, the bag technique. Bag technique is a tool making use of public health bag through which the nurse during his or her home visit can perform nursing procedure with ease and deftness, saving time and effort with the end in view of rendering effective nursing care. So for the public health bag po, it is an essential and indispensable equipment of the public health nurse which he or she has to carry along when he or she goes out for home visiting. So it contains basic medications and articles which are necessary for giving care. So for the principles po, bag technique helps in infection control. Then bag technique allows the nurse to give care efficiently. Then the bag technique should not take away the nurse's focus on the patient and the family. Then bag technique may be performed in a different way. So for the equipments needed po, and then the contents of the public health nursing bag, the procedure po is first, upon arriving at the client's home, place the bag on the table or any flat surface. So I have here flat surface table. Then land with paper lining. So paper lining, it should be clean side out. So this is the paper lining. I will put it here in the flat surface. Like that. So after that, I will ask for a basin of water and a glass of water if faucet is not available. Then place outside the work area. So I will place it outside the work area. Then open the bag, then take the plastic lining and spread over work field of our area. So we're going to take this plastic lining, then same with the paper lining, clean side out. So this is to avoid the paper lining from soaking. Then after that, I will now going to put public health bag on the table. So in putting, I will going to fold the strap underneath. Then I will going to place of the bag. It must be covered under the paper and plastic lining. So I will put this public health bag here po. Then after that, take out hand towel, soap dish, and apron. So the hand towel and then the soap dish. I will put it here, one corner of the work area. The towel, the soap dish, and then the apron. So then after that, I will be going to perform hand washing. So here I will ask a family member to help me in performing hand washing by pouring water in my hands. Then assume that I am done performing hand washing. Then next is I will use a towel to make my hand dry. We'll use this towel to make my hand dry. Then place it back. Then after that, put on apron, right side out and wrong side with crease touching the body. Then sliding the head into the neck strap, then neatly in the straps at the back. So we're going to tie it then. Then after that, put out things most needed for the specific case. So in my case po, I will be going to assist wound caring. So using a betadine, gloves, cotton balls, gauze pad, micropore tape, and forceps. I will put it here po. The cotton, gauze pad, the gloves, micropore tape, and then the forceps. So after placing it po, I will going to place waste paper bag outside of work area. So I will put the paper bag po here. outside the working area. Then after that, I will close the bag. Then, I will going to proceed to the specific nursing care or treatment. Then, assume that I am done wound caring. So, after completing nursing care or treatment, clean or wash or sanitize reusable articles that has been used. So, going to clean this block. So, after that, do hand washing again. Then, after doing hand washing, open the bag and put back all articles in their proper places. Then, remove apron, folding away from the body with the soiled side folded inwards and the clean side out. Then, place it in the bag. Like this po. Then, after that, place it in the bag po. Then, fold the linen or plastic lining clean. Then, place it in the bag and close the bag. And then, place it po in the bag. So, for the continuation of the home visit, then conduct physical examinations, provide physical care, and simple diagnostic examinations if available for the concerned family member. So, then conduct health teaching and counseling to the family as needed. Then, if further services cannot be provided, explore with the family other facilities for referral. Then, evaluate with the family what you have accomplished during the visit. So, for the termination, summarize with the family the events during the home visit. Then, set subsequent home visit or another form of family nurse contact. And then, record findings. Then, thank the family for extending their time for a home visit. Then, return to the health facility. Then, for the post visit phase, document and record events that transpired during the visit, and then if appropriate, a referral may be made. And if a subsequent visit has been set, plan for the next visit. So that's all po. Thank you.